I think based on lifestyle factors, genetics, there's going to be different ways people need to eat. So carnivore, vegan, paleo, keto, whatever. Uh, Find exactly what works for you, and then actually have some data to figure it out. Because the problem a lot of times is there's too much information out there, and how do you sift through it all? And then you share what you've learned, and someone gives you a completely opposite opinion, and then you have an existential meltdown, and then you realize, okay, let me just get back to the lowest common denominator here, which is some objective data. If I change my diet according to what Dr. Justin tells me, let's say I go autoimmune keto for 6 weeks, according to Dr. J, do the labs get better? That is simple stuff anyone can do, but you need the numbers. And there's a lot of people who eat and live a certain way, but their labs might look like total crap. So that's where the numbers can actually maybe tell you that you're not doing as good as you thought you were.
Exactly. Also, one of the big things is depending on where your level of health is, what tier of health you're in. Let's say here's the highest tier, here's a middle tier, here's a low tier. People that are in a low tier and already have hormonal issues or thyroid issues or an autoimmune condition, bringing in something like intermittent fasting may actually be a stressor. Bringing in something like resistance training or interval training or some kind of a more intense exercise may actually be a stressor. But this person up here at a higher level of health, they may be able to do some eating restriction before bed and actually benefit. They may be able to do more resistance training and CrossFit and benefit. These are the people that may do well with carbohydrates at 200 or 300 grams per day because of their oxidative stress and how much resistance or aerobic training they're doing. So there's different tiers, and I always recommend like figure out what tier you're on and don't try to be, at the lower health tier and do things that people are on at the higher level of tier doing. It's not a direct correlation. It's not like these people are healthy because they do that. Because they're healthy, they can do that. And you have to kind of, figure out what avenue to go into.
You bring up some really, really important points there. One is so there's probably a lot of people, and you've mentioned this before to me. There are people who are actually too low carb, and
Yeah.
they're training too hard in the gym doing CrossFit. And you'll see that. You'll see your HRV and it's in the toilet. And maybe your thyroid numbers are in the toilet, and you're not feeling great, and you're not sleeping great, and you're cold. And then you ratchet up the carbohydrates and you look at the numbers and you're like, holy crap, I feel better. I'm sleeping better. My HRV is better. So that's a part of it. And then you bring up another great point, which is when I was working with you as a patient, there was a
Yeah.
period where I was completely healthy and I could go train like a beast in the gym and then just basically go to bed and have a great sleep and go to work the next day. And then as I went through some life stressors, I got to the point where that same type of exercise actually was a nightmare for me because my body was already in a high stress state. So that same workout that I could have done without even thinking about it a year ago, now my cortisol would stay elevated and I'd be awake till 3 in the morning because my body was already in a stress state. Now I'm out of that stress state and I can do those types of exercises I couldn't do before. So again, that's where having some numbers can also be really, really helpful.